Hello and welcome to our Fascial Fix for back pain. Back pain is a very common pain condition. Lots of people suffer from it, and it doesn't just involve pain. It also can be discomfort, stiffness and difficulty with moving. Lots of people find that they have lower back pain as the main issue, although it can equally be mid or upper back pain. For a lot of people, the pain that they're suffering is not coming just from their back. It can be coming from other areas of the body, hips, legs, and so on. In this video, we're going to share some simple self-help myofascial exercises that can help to release some of the restrictions that may be contributing to your back pain. In this exercise, I'm going to use two myofascial balls that I've placed in a bag to make sure that they stay together when I lie on them. And I'm going to make sure that the gap between the balls is where my spine is, so I'm not putting direct pressure on the bones, which can feel uncomfortable. So I'm going to place the balls on my mid back, so that's just above the bottom of my rib cage. So when you do this exercise, when you first start, it can feel quite uncomfortable, particularly if your back is tight. The back's not used to stretching backwards like this over the balls, and so the tissues can feel quite uncomfortable until everything starts to relax. It's a good idea to have a pillow like this under your head and your upper back, just to support your body in this exercise. So while you're here, just allowing time for the tissues to start to release around the balls. The back is supported by a lot of muscles and tissues, and there's a whole group of muscles that run either side of the spine, all the way from your pelvis up into your head. When these become tight, it can restrict the movement of your back, and this can start to contribute to back pain that you may feel in the middle of your back, or you might feel in other areas such as your lower back, or even up into your head as headaches. So by allowing time for the tissues to start to release, this will start to progressively allow the whole of your back to loosen. And as long as you're here for at least a couple of minutes, then the tissues will be starting to release and let go. If you find that it's uncomfortable to do this exercise lying down, then you can also do this seated with the balls against a wall or against the back of a hard-back chair, or standing leaning against a wall. So whichever way you do this, as long as you feel comfortable, then it will be allowing the tissues to start to release and let go. In this exercise, I'm going to do a spine twist. To do this, I'm going to lie on my back with my knees bent. So when I'm here, I'm now going to drop my knees over to the right and allow things to start to relax. Now, if you're like me and you find that your knees don't touch when you're in this position, you can put a pillow in between them, and that just helps to support your legs and your hips and means that you can allow things to release and relax. The spine twist is a really nice exercise to do to open out your hips and all the way through into your back. It's important to keep both shoulders on the ground when you do this, so the actual twist is coming in your lower back and in your hip. And by doing this, this can start to release some of the restrictions that may have formed, particularly around the side of your hip. And these can be contributing to lower back pain and hip pain, even leg pain. So as you're here, you're just allowing things to start to release and relax. And you may feel sensations that may be in the area around the side of your hip, or even coming up into your back or down into your leg. So whatever you're feeling, that's fine, that's okay for you. And if you want to create a slightly deeper stretch, you can straighten your top leg out. And this will stretch more into the side of your hip in particular. So this is a great exercise to do if you have lower back pain, if you have knee or hip pain, and it can really help to release round into your back as well. So I can feel this coming up into my mid back, and sometimes people feel it coming up into their shoulders. And so as long as you're here for at least a couple of minutes, then it's allowing time for the tissues to start to release and let go. And then we can do the exercise on the other side. Coming back to the midpoint and then dropping your knees to the other side. Again, my knees don't touch, so I'm going to bring the pillow over again and place that between my knees. Again, this is just allowing my body to start to relax and release, and starting to feel a stretch coming into this side of my hip. If you're comfortable doing this exercise on the floor, that's great, but you can also do this on your bed if that's more comfortable for you. And again, if you want to create a deeper stretch, then you can straighten your top leg out and just allow it to drop down. And so the weight of your leg is now creating a deeper stretch, coming round the side of the hip. You may feel it more in your hip, in your back, in your leg. Wherever you're feeling it, that's fine. That's your release pattern. And you're just waiting for a sense of the tissues starting to release and let go. So really good for helping to loosen your lower back and mobilize the tissues here, and for starting to release around the sides of your hips as well. So just being here for at least a couple of minutes allows time for the tissues to start to release and let go. In this exercise, I'm going to use a myofascial ball on the side of my hip. I'm going to turn around just to show you the area that I mean. So the side of your hip is here. You can feel that there's a top of the bone here which comes round to the front, and it then comes all the way around to the back. And in this area, on top of the bone, are a number of muscles and a lot of fascial tissue, and the job of these muscles is to rotate your leg as you walk and you run, and particularly rotating out but also back in. And this is the natural movement of your leg when you're walking or running. Sometimes this area gets restricted, and it means that your leg can no longer freely rotate, and that's when problems start to develop. So we're going to place the ball here on the side of the hip. So just make sure when you start that you feel the bone and you know where you're going to be placing the ball. So when you're here, make sure that you feel comfortable and you allow time for your body to relax around the ball. At first it can feel a bit uncomfortable, especially if your hip is tight. But as you relax here, you'll start to get a sensation of the tissues releasing and changing. Now when you're working here, you don't have to be precise. As long as you have the ball on the bone on the side of your hip, then you will be releasing the tissues here. You can move your body around the ball if you feel that there are other areas that you want to work on. And sometimes people find that this is easier to do if they do this exercise standing and leaning against the ball against a wall. So whatever works for you is fine. The main thing is to be here for at least a couple of minutes, as this allows time for the tissues to start to release and let go. And you may find that you feel sensations here while you're lying on the ball. And working here is particularly good for lower back pain and even for knee pain. And so now I'm going to work on the other side. Again, on this side, making sure that the ball is placed on the bone on the side of your hip, because this will then start to release the tissues, the muscles that sit on top of the bone. So for a lot of people, if they have restrictions in the side of their hip here, it can contribute to lower back pain. And that's because if your leg is not freely rotating as you walk or you run, then the force will have to go somewhere else, and very typically it comes up into your lower back. But equally for some people it actually travels down their leg into their knee, so particularly down the outside of the leg into the outside of the knee. And again, that's because the leg is not able to freely rotate in your hip. And so by working here, you can start to help the tissues to release and restore that rotational movement in your leg, which takes the pressure off your back and it takes the pressure off your knee. Again, you can work on this side either lying on the floor or on your bed, or you can do this leaning against a wall. Whatever feels comfortable for you is fine, and as long as you're here for at least a couple of minutes, then it's allowing time for the tissues to start to release and let go.